So hi there, this is Tracy, and today I am talking with Ann Devereux. Ann Devereux is an acupuncturist, and I know that as a survivor and a thriver, we go through different parts of our recovery where stress, anxiety, very often trauma is involved. And so I wanted to talk to Ann today because as an acupuncturist, she knows a lot about these subjects. Tell us about trauma and how acupuncture can help.
That's a great question. As you mentioned, there are a lot of people in this world that have or are experiencing trauma. I'd love it if those statistics were lower, but they're not. So the way that I treat trauma with acupuncture is through a combination of acupuncture treatment in the body as well as in the ears. There's a system of acupuncture called auriculotherapy that is very powerful for treating both the mental and the physical manifestations and repercussions of trauma. And it's nice because by working in the external ear, you don't need to change your clothes or, prepare in any particular way. You can be seated or laying down for that type of treatment. Auriculotherapy in particular has been used by military personnel, has been used by addiction specialists, and has also been used by therapists. So it's great at treating a multitude of conditions, including trauma. So I like to treat the ears on both sides as well as points in the body. And the points in the body vary quite a bit depending on what is going on for that specific person. So trauma is, while it is an umbrella term, it shows up for each individual person in its own way. Mm-hmm. For some people they have trouble sleeping, for other people they sleep more, there are increases or decreases in appetite, sometimes there are cold sweats, sometimes there are hot flushes. Trauma manifests both physically, mentally, and emotionally differently for each person. Mm-hmm. And so what I do here is patient-centered care. So I treat the individual person and how that trauma is manifesting for them at that time.
Okay. So for me, I know I experienced like a shutdown of a lot of my organs when I first was diagnosed with the PTSD and finding out that I was in that kind of trauma. Yeah. So you can work on organs as well.
Yes.
Can you identify what is not doing well?
Yes, exactly. So traditional Chinese medicine predates modern Western medicine by thousands of years. So I don't order blood work to see how your organs are functioning. It didn't exist when this medicine was developed. Instead, what I do is I look at your tongue and I take your pulse on both wrists. And while you have one heartbeat, and so therefore one technical pulse or heart rate, what I'm checking for the quality of your pulse in multiple positions on both wrists. And that gives me an indication of what's going on inside your body, in addition to what you described to me as your experiences and your symptoms.
Mm-hmm. Wow. So let's get started.
Okay, fabulous.
Great. So she's going to do a little bit of acupuncture on me. Wow, what a nice soft bed. Oh, I may never leave.
I get that a lot. So I'm going to have you lift up your knees. So I'll let you stick your tongue out at me. Can I see the whole thing? Great, thank you. Perfect. And then I'm going to take your pulse in 3 different positions on each side, both superficial and deep positions. And that gives me an assessment of the 12 primary organs in the Chinese medicine world.
Okay.
Oftentimes what I feel in the pulse usually supports what you describe in terms of your symptoms. Mm-hmm. Sometimes, however, there are little differences, and so that can elicit a deeper conversation if there's something maybe that you forgot to mention or something that you didn't think was relevant. Mm-hmm. So it's not uncommon during this stage to ask about, say, digestion or sleep habits if I do feel something change in the pulse.
Mm-hmm. I know I have a lot of, I could call it foggy behavior, where I'm just forgetting. It's almost like that amygdala is not working anymore.
Yes.
And it can come and it can go.
Yes.
Is that like common?
Absolutely. Yeah, foggy-headedness, changes in memory, those are not uncommon at all. So I'm going to sanitize my hands here. And I'll start with your ears, if you don't mind.
Okay.
And then we will move on to your ankles and wrists.
Okay.
Is that all right?
Sure.
Okay.
And is there a set amount of needles that people need, or is that based on what their symptoms are?
You know, that's a great question. There is no set amount of needles. There is a common range. I believe among most acupuncturists, probably 10 to 30 needles is the most common. It depends on whether that practitioner is using, say, auricular therapy solo or in addition to body points or just body points.
Okay. And how long does someone sit with these inside of them?
That's also a great question. Most needles are retained for about 20 minutes. Sometimes they can be retained longer or for less time. The important thing to bear in mind with the duration of needle retention is that more isn't always better.
Okay.
If needles are retained too long, there's a chance that you could walk out of here feeling tired rather than refreshed.
Oh, okay. Great. And I know people are going to wonder this.
What's that?
Do they hurt?
That's a great question. I have a display box with the needles. I'd be happy to show you it.
Okay.
But each needle is just thicker than a hair. So they are a little bit pokey, as they should be. They're needles and they're sharp and sterile. But beyond that initial tiny poke sensation, there really should be nothing.
Okay.
In the ears, that pokey sensation is a little bit more intense just due to the sensitivity of the ears. But once again, once the needles are in, that sensation diminishes entirely.
Okay. Great.
Great. So I'll let you look to the left. Thank you. Okay. And then we'll do the other side as well.
Okay.
How did those feel?
Didn't feel them go in at all.
Wonderful.
Now, do I tilt my head that way? Am I going to...
No, I'll let you just look forward for the
Okay.
second time.
Now, how many times would somebody, like, get this treatment to really, really see a difference in the things that are happening in their body?
That varies from person to person. I usually recommend a more frequent treatment the more severe and acute any condition is.
Okay.
So it's that idea of nipping something in the bud. If there was a traumatic experience that occurred last week, I would recommend coming in frequently, maybe once per week, maybe twice per week, for a shorter period of time.
Mm-hmm.
If the trauma or the injury occurred a long time ago, and the ramifications have been experienced for a longer period of time,
Mm-hmm.
then I would recommend coming in a little bit less frequently, but for a longer period of time.
Okay.
Does that make sense?
Yeah.
Okay. So we'll have 5 little pokes on this side. There you go. How are those feeling?
That one feels a little different. Like, it definitely, I wouldn't say it hurts, but I feel them versus the other side. Is that common?
That is definitely common. Usually one side will be more sensitive than the other, and oftentimes that has to deal with the side of your dominant hand. Usually the ear on the side of your dominant hand will be more sensitive than the other ear. However, for some people who were born left-handed and then switch to being right-handed or remain left-handed throughout their life, they can do what's called oscillating, which has to do with laterality in the brain.
Mm-hmm.
So the opposite ear may be more sensitive than the side of the dominant hand.
Okay, great. Now, I know that all acupuncturists, as in any profession, are not equal.
Mm-hmm.
What should people look for when they're looking for an acupuncturist?
I think, especially in Boulder County, but this is true anywhere, it's important to find somebody that you get along with, that you see eye to eye with, that you're on the same page with.
Mm-hmm.
If you don't feel like you have a good rapport
Mm-hmm.
with your practitioner, studies show that the outcomes may not be quite as good. So if you feel like you're able to work as a team with your practitioner,
Mm-hmm.
and that you feel heard, and that you're able to receive what they suggest, then you have a greater likelihood of success. So I think that that's really important. Obviously, making sure that your practitioner is licensed, experienced, and trained in the area that you would like care. That's
So
really
it is a
important.
licensing position?
Yeah.
Okay.
Yeah.
And make sure people look for that.
Yes, yes. So in Colorado, we have a state license, and we also have a national certification.
Mm-hmm.
In other states like California, there's only a state license that's important, and they're not as concerned about the national certification.
Okay.
In some states, there's no regulation at all.
Ooh. Well, we've got people on my YouTube channel that come from every country around the world.
Really?
Oh, yeah.
Oh, that's fabulous.
Yeah. So,
Good for you.
I know, it's kind of cool.
That's great.
Mm-hmm.
So I'm just going to scooch up your pants here,
Okay.
and I'm going to be working on this interior portion of your ankle.
Okay.
So as you can tell by my hands here, this is a sensitive area.
Mm-hmm.
So if any of these needles feel sharp or uncomfortable, please let me know.
Okay.
Okay? I'm going to clean the area here with rubbing alcohol.
Has anyone ever kicked you?
No one's ever kicked me. But a lot of people do have tells.
What do they have?
Like in poker,
Uh-huh.
you know, a tell. So if something's uncomfortable but they don't actually speak up, sometimes they'll move their hands or they'll wiggle their toes. So
Oh, okay.
I've seen a lot of toe wiggling, but not a lot of kicking. Okay. And then we'll move on here to your left wrist. Thank you. I'll just let your arm rest here. Is that comfortable?
Mm-hmm.
Once again, you feel a little rubbing alcohol. Okay. How are those needles feeling?
Not bad.
Fabulous.
Yeah.
Great. Any other questions?
So now I would just sit here and bake.
Yes, sit here and
Right.
bake. Yes, so now the needles would be retained for about 20 minutes,
Mm-hmm.
during which time I recommend my patients relax, doze, daydream, think about an upcoming or past vacation.
Mm-hmm.
The only prohibition is to think about anything stressful.
Okay.
The more you can relax during an acupuncture treatment, the more effective it is.
Mm-hmm.
What we're doing here with all of these needles, we are giving your body a number of very specific messages
Mm-hmm.
about how it needs to change in order to come back to balance and self-heal.
Wow.
So that's what all of these needles are doing. From a Western medical perspective, we see regulation in the nervous system, we see regulation in the endocrine system, and in the circulatory system.
Mm-hmm.
So when you talk about trauma, one thing that often comes up is this fight or flight idea.
Mm-hmm.
And that's exactly what we're treating here. So the nervous system can shift. You'll often hear your stomach grumbling a little bit.
Mm-hmm.
And that's the shift from fight or flight into rest and digest.
Wow.
And so the more you can relax and allow these messages to be circulated through your body, the more effectively they're circulated and the more effectively they're received.
Wow.
So it is now your job to relax, as much as possible.
I can do that.
Yeah.
Awesome.
Yeah. So what we're doing here, like I mentioned, with the ear points, there is actually, as you mentioned earlier, the amygdala, and there is an acupuncture point in the ear specifically for the amygdala.
Wow.
That deals with irritability and essentially stress and trauma. The points that we use today are part of the NADA protocol, which is the NADA. It's the National Association of Detoxification Acupuncture. And what they do is they specialize in treating addiction with these 5 points. But these 5 points are used, like I said, with military personnel who are dealing with PTSD. They're also used in a number of situations. For example, this was a point combination I used in helping survivors of the 2013 floods. I was up at the FEMA Center in Longmont, and we used this point combination. Also up in Jamestown after the floods. And the volunteer work I do at the Safe House, we use these points as well. So they have a lot of different applications, and they're incredibly powerful.
Wow. That's really cool. What else do we need to know about acupuncture?
It's incredibly safe. Like I said, as long as you're working with a licensed practitioner who's graduated from an acupuncture school. My training was 4 years. Other schools provide training in 3, or other programs are a little bit more condensed. So there is extensive education and training that occurs in becoming an acupuncturist, and so making sure that you find a licensed acupuncturist that's essential. Yeah.
And do you work with herbs or any kind of supplements to help, like, balance back the system?
I do, yeah. So during a treatment, obviously what we're focused on here is acupuncture. However, I like to make sure that this is a dynamic process and that I work as a team with my patients. So when I talk about, the treatment that we are doing, it would be you and me both. I'll do the acupuncture piece, but then I'll likely give you homework. And that homework can be Chinese herbs, it can be dietary changes, mild lifestyle changes, things that fall within the scope of traditional Chinese medicine, but allow you to take an active role in this treatment and to see greater benefits over a longer period of time. So it's nice that we can work together in order to see the greatest impact moving forward.
Okay, cool.
So how are you feeling?
Good.
Good.
Yeah.
Fabulous.
Didn't hurt at all.
Good. And then remove your needles.
They're gone.
Okay.
Woo. All right, thank you.
Yes, thank you.
Yay.